Good afternoon and welcome to the virtual clinical classroom. Today we're going to be talking about peripheral artery disease and how that disease affects the functionality of people every day. First, a quick review of the lecture we had on Monday, and then we're off to the clinical laboratory to put theory into practice. The severity of peripheral artery disease closely parallels the risk of myocardial infarction, ischemic stroke, and death from vascular causes. Did anyone realize that up to 1/4 of our population is affected by PAD? Patients with current or past tobacco use, diabetes, hypertension, hyperlipidemia, or cardiovascular disease are at an increased risk and should be screened for PAD and then targeted for aggressive risk factor intervention, such as smoking cessation, control of diabetes, and appropriate diet. A simple procedure used for determining if a patient has PAD is the ankle brachial index. This is a procedure we will be doing in the clinical laboratory today. Let me give you an example. If my right arm systolic pressure is 120 and my right ankle systolic pressure is 140, I would divide 140 by 120, which would equal 1.166, or normal. Let's look at the values. So anything greater than 0.90 is in the normal range. In your skill packets is the sheet you will use to perform an ABI on your partner. You will first observe 2 students, then practice with your partner, and let me know when you're ready to demonstrate your success. You will then print and sign off your name and today's date. But first I will demonstrate the procedures. Are there any questions before we begin? Remember, it's always important for the professional nurse to introduce themselves to the patient and to explain the procedure, answer any questions before you begin. Good afternoon, Mr. Miller. How are you doing today?
I'm okay.
Good. We're going to be doing a procedure called an ABI index. What that means is we're going to be doing your blood pressure at your arm, and we're going to take a blood pressure at your ankle, and it will give us a number that will tell us how well the blood is flowing through your arteries.
Okay.
Do you have any questions?
Not at this time.
Okay. Let's begin. Good. Remember, when you're taking an ankle pressure, you need to make sure that you have a good pulse. Mr. Miller has a very strong pulse. You can look onto a dorsalis pedis or a posterior tibia. If you are unable to feel the pulse, then you need to get a Doppler. That's why we have it listed for equipment. Good. Thank you, Mr. Miller.
Thank you.
And now we're back in the classroom. Let's see how Mr. Miller did. For his systolic pressures, his arm was 124. His ankle was 142. If you remember, we're going to take the ankle, divide by the arm. Can anyone in the classroom calculate quickly?
1.145.
Good. 1.145. That one doesn't want to be very... So we look at our ranges, and 1.145 easily falls within the normal range, which will be good news for Mr. Miller. Thank you for joining us today in learning about the AB index screening. I'd also like to thank all the contributors that helped make the virtual classroom a reality. Goodbye.